So the moment you want to consider egg freezing, I would suggest meet a fertility specialist a month prior. Get your basic health checked. Your detailed history will be taken, and then your basic investigation with regards to your egg reserve is being done. That includes certain blood tests like AMH, FSH, which will give us an idea about the quality of the egg. And they may also do or advise you to get an ultrasound done, pelvis, to check how many follicles are there in each ovary, whether any associated conditions are there like endometriosis or adenomyosis or something else. So once we do this baseline health investigations, your AMH, FSH, which will tell us about your egg quality, and your ultrasound pelvis, this will give us an idea as to how to go about the egg freezing stimulation protocol. What should we plan, how should we plan, when we should plan, and how much would be the success rate, how many rounds of egg freezing if required would be advised to you, or maybe even one cycle of egg freezing is good enough. So all this planning we can do once we know this baseline. So the first part would be investigation and getting your medical history done. Second would be stimulation. So usually the stimulation of your ovaries usually starts during your period, second or third day. We start giving daily injections, which are very, very small, thin needles, like they come in the form of pens, which you can take it on your own. These are hormonal injections in order to grow multiple follicles, which are present in that particular month. So we grow all the follicles. Your doctor may ask you to come once in 4 days to check how the response is because of these injections. How long does this take? Maybe 8 days, maybe 10 days, depending on your particular body. So once all these follicles are ready, then we go to the third stage, that is called the egg retrieval. Egg retrieval is done under anesthesia. It is absolutely painless and there is no scar or cuts or anything. We go vaginally using an ultrasound, put a thin needle, and we collect and aspirate that fluid which is there in the follicle and check under the microscope and look for eggs. So fourth step is freezing. So these eggs whichever are collected, we wash them and remove all the unnecessary additional cells which are present along with the egg and freeze these particular eggs in liquid nitrogen at minus 196 degrees centigrade. These can be frozen for as long as up to 10 years. See, side effects as in definitely it is something which is not naturally happening in your body. We are stimulating all the follicles. So you may have lot of heaviness and bloating in your abdomen. This is again temporary. Once you are done with the egg freezing process, you will be back to your normal routine. Second, each follicle will produce estrogen which acts on your breast. So you may experience breast tenderness as well. Now this again depends on person to person. Some of them may have very few follicles, few eggs are retrieved. So they may not have any of these symptoms at all. Third, injections. Definitely the word injection itself is very scary. Taking every day, pricking every day, so those who are scared of it and all that, they may get very anxious, and that injection site little pain will be there. But the injections which we have nowadays are very, very thin needles which are more like a hair kind of thickness, our human hair thickness type. And we just use that and it is absolutely painless. Maybe for few seconds you may feel pain, but otherwise there are no major side effects as such, because we follow a protocol called anti-OHSS protocol. So wherein we do not let you go into a serious complication stage called OHSS, ovarian hyperstimulation syndrome, shouldn't happen. So nowadays all the fertility centers all over the world follow this anti-OHSS protocol. See, the success rate usually depends on, like we discussed initially, absolutely on your age, on your associated medical conditions, on for the reason why you are freezing. Like if in case you are having a medical condition like endometriosis, definitely the egg quality is lower even if it is a very younger woman compared to the same age woman who doesn't have this particular medical condition. On an average, if it is a healthy woman whom we have got many eggs and then we are using it later on, she wants to come down say after 5-6 years and she wants to plan the baby, the success rate will be somewhere around 50%. So ideally the number of eggs would be from somewhere around 10 to 15 eggs. If we freeze, the chances of us getting at least 3 to 4 good quality embryos is better for a woman who is less than 33 years of age. But if it is a woman who is more than 33-35 years of age, maybe we will require more number of eggs. So the more number of eggs which are mature good quality M2 eggs, the more we freeze those, the chances are that we will get better quality embryos also. See, as we all know that women are born with a fixed number of eggs. So as we age, the number of eggs, the quality and quantity declines. More so rapid decline happens after they attain 33 years of age. So definitely the right age, I would say, is consider freezing your eggs maybe around your 20s or late 20s would be the ideal and the correct age, because we get better quality eggs to freeze, which you can definitely will be giving a better outcome later on when you want to use them, if and when that time comes. The success rate comes down, as in the better quality eggs you freeze when you want to use them, say down the line maybe after 6 years of age, when naturally you are not able to conceive and you want to use those frozen eggs. If it is for a 45 years old woman, I am freezing the eggs, then definitely the quality of egg will be less. The quantity of eggs which we get also will be less. She may require more cycles of egg freezing, which later on, if she wants to use, may not become a good quality embryo or a healthy pregnancy. So definitely not that you shouldn't consider freezing if you are above 30 or something like that. You can freeze your eggs starting from 21 years of age to up to 50 years of age. So even women, if you all are in your 30s, late 30s, 40s also, and still are not sure and want to just go ahead and freeze your eggs, it is not wrong, or it's not going to lead into some complication or anything. But definitely the chances of having a healthy pregnancy with those eggs will be comparatively lower. Yes, definitely. So egg freezing is done only for that particular month's eggs. So for example, if I am doing an egg freezing of a woman for this month, say for the month of March in her cycle, we are going ahead and taking out the eggs and we are freezing it. Doesn't mean I am taking all the eggs which are there in her life. So it's more like, if you compare for an example, how much money is there in your bank to how much money is there in your wallet. So we are only taking what is there in your wallet right now. The bank still has enough money, and every month you can still withdraw whatever it is accordingly. They can be frozen for as long as 10 years.